Good morning, good afternoon, good evening to all our participants. We're delighted that you are with us today. My name is Dr. Krishna Jaffa, and I'm the CEO of Precision Global Health. And it's my privilege to kick off the discussions that you're going to hear today, which will be in three parts. The very first part of our webinar today is going to focus on the impact of both COVID-19 as well as the positive impact of receiving PPE that then protected CHWs. So I would like to introduce the first panel, who is going to speak about the impact of both the pandemic as well as of PPE from the perspective of three very different country contexts. I'm delighted to introduce James Lipenga, who is a community health worker supervisor in the southwestern part of Malawi that also shares an extensive international border with Mozambique, neighboring Malawi. And he will share with us both some of the challenges as well as some of the opportunities that are now created when community health workers are protected. Next, we'll hear from Freddie Nkosi, who is Village Reach's country director in the Democratic Republic of the Congo. And last but not least, in hearing about the impact, you're going to hear from Dr. Maureen, who is the National ICCM Coordinator for the Ministry of Health in Uganda. So with that, really excited to get this first conversation started. We're going to kick off with James. James, you are a community health worker supervisor in a fairly remote part of Malawi, 6 hours from Lilongwe, as I understand it, the national capital. And you also have a pretty extensive international border, as I mentioned, with Mozambique. Can you share with us what the experience of COVID-19 has been like, both from when it first started affecting your work and impacted your community up until the present, when vaccines are beginning to be rolled out? Thank you.
Thank you so much, Krishna, for having me. My name is James Lipenga, CHW from Malawi. My roles include screening children from malnutrition, vaccinating children, supervising water and sanitation activities, screening for TB at the community level. During this first wave of COVID-19, the government expected us to continue doing our work and add on the role screening for COVID-19 suspected cases to the rapid response team that exists at the district health office. We were afraid because of this COVID-19 because we did not have PPEs. The government revised some of our workflows. For example, we stopped collecting sputum from the community, screening children for malnutrition using MUAC, main upper arm circumference. However, in the course of our work, we received consignment from CAF Africa and again from partners in health. We were able, and again, we were excited with the consignment in such a way that it paves way from our fear. Since we did not have these PPEs, then we were able at least to resume to our previous work. For example, like screening, go ahead with the screening. So those are some of the activities that are done during this. Right now, I just want to talk on the situation that is here in Malawi. Last 24 hours, we got few cases, meaning to say COVID is going down in Malawi. We have got few cases that has been recorded in 24 hours. And finally, good news to say that as a CHW, I got a single jab vaccination of of COVID-19 last week. Thank you, Krishna.
That's so wonderful to hear, James. And thank you so much for sharing the story, which I think really brings alive for our audience. Many of us are not on the front lines. We're not in countries where there are resource constraints. I think it really brings alive for us the experience that you had. And because we've all been reminded so many times of the timeline of the COVID-19 pandemic, could you briefly share with us when you started providing COVID-19 related services in 2020?
We actually started this 2020 in February.
Wow.
2020. Yeah, it's where we started that.
It was very early in the pandemic. And when did you receive PPE for the first time?
It was in April 2020. It's when we received that consignment.
Okay, that's yeah, really interesting. So it took a couple of months to get the PPE to you. Yeah, I think a
Yeah.
really great reminder again of the importance of protecting our frontline workers. And thank you again, James, for sharing that story. We're going to switch geographies a little bit more. So, Dr. Maureen, I'd like to reintroduce you as the National ICCM Coordinator for the Ministry of Health in Uganda. You have been a champion for community health workers throughout your career, and that has become even more evident when the COVID-19 pandemic hit, and you've provided so much leadership and inspiration to the CAF Africa team in helping us support your work. I know that you've had a lot of challenges, and I know that you've been able to address so many of them. So if you can share the story from Uganda in terms of, this leadership position that you have, the bird's eye view you have across Uganda, what were some of the challenges and what are some of the opportunities and gaps that remain? With that, over to Dr. Maureen, and if you can just unmute yourself, that would be great. Thank you.
Thank you very much, Krishna, for the introduction, and thank you all for being a part of this. Well, at the start of the COVID-19 pandemic in March, we well know that the whole world was hit and Uganda as well was not spared. And we had efforts across the country to protect the health workers with personal protective equipment. But these were, however, prioritized to the health facility workers and not the volunteers, community health workers, as we call them in our country, the VHTs. VHTs being a voluntary health cadre, they were not required to work under these circumstances. However, we very well know that the VHTs are the first point of care, of contact in the communities and provide basic health services and education to over about 84% of the Ugandans living in the rural areas. And it's therefore essential that we consider PPE for these people. However, as we moved further to the current phase 4, which is the community transmission stage of the pandemic, the need for the VHTs was critically crucial and important for them to be a part of this, especially for surveillance, for home-based care, for community engagement. And we very well know that COVID-19 has similar symptomatology with malaria and pneumonia, which are the cases that are handled at the community level by the VHTs that are offering case management, especially for the integrated community case management of childhood illnesses. So there was really a need, and facilities were closed across the country, and we had most services that are shifting to the community. And therefore, it was imperative that really we have the VHTs work, because this was already an additional burden to them. We've had quite a number of PPE donations coming into the country, but these have been piecemeal from different agencies. But CAF Africa sent the largest quantity to protect over about 80,000 VHTs across the country. And this has had several positive impacts in ensuring continuity of essential services at the community level, like for malaria, pneumonia, diarrhea, exposure to TB, among others. And this has also maintained the trust and confidence among the VHTs, but also strengthen our collaboration between the private and the public sector for services. We provided this PPE across both the public and the private sector, and therefore the collaboration was strengthened, and we had reduction in severity of cases because the cases were seen by the VHTs within the first 24 hours. And to date, we thank our partnership and advocacy for the VHTs, which is increasingly getting onto the agenda. The VHTs were able to receive the PPE, those are the face masks, eye goggles to enable standard operating procedures and support for continuity of essential services. But we also modified the guidelines for implementing the ICCM within the COVID, trained the VHTs on the standard operating procedures for COVID-19 prevention, and also the president endorsed the new community engagement strategy for COVID-19, where the community health workers, the VHTs, will be paid a particular salary by government. This may not run across the country, but it's a step for us in the right direction. The PPE quantifications have also been included in other grants, like the Global Fund grant, especially for ICCM. We, however, remain with a few gaps where there is need for advocacy for the vaccine of the VHTs as they continue to remain last in line. We know that the phase 1 of our vaccine within the country was mainly for the health workers, the teachers, and the force. And we hope that within the phase 2, at least with our advocacy, we will be able to also have this vaccine for the VHTs since they are frontline health workers. There's also a continued need to rally to support the VHTs at all fronts and remunerate them, as well as make sure that they're able to provide these services. We know that PPE is still essential even during this period of COVID, and therefore we continue to advocate and ensure that we have enough PPE for the VHTs as they continue to do their work. Thank you.
Thank you so much, Dr. Maureen, for sharing with us both what some of the struggles were as well as what some of the opportunities are. And just very quickly, what's the timeline for rolling out COVID-19 vaccine, and are CHWs currently included in the quantification and in the rollout plans, or is that still to be done?
Well, within the first phase started within March, and it ends around April, and we'll have a second batch coming in May. The first batch does not have the community health workers apart from those that are elderly, but the second phase, yes, we have advocated for inclusion of the VHTs within the second phase of the vaccination within the country.
Thank you so much. And with that, from Dr. Maureen in Uganda, we're going to switch to Freddie in the DRC, and hopefully at least his audio will work at this point. So Freddie, without any further delay, over to you.
Yeah, thank you very much, Krishna. I'm very excited to share the experience of the Democratic Republic of Congo in the distribution of PPEs to reach some of the community health workers, especially those living in the rural areas. And we were able to achieve greatest results because of a strong partnership between the Ministry of Health, Village Reach, but also other technical partners, even other donors who came together to support this distribution. When I hear James' story about how community health workers were not prioritized in Malawi, this also relates the same story in the DRC. At the beginning of the pandemics in March last year, community health workers were not a priority to receive PPEs, as there were very limited quantity of PPEs, but high demand. So the priority was given to frontline health workers or those who are working mainly or treating a COVID patient. So with the collaboration with CAFA, we're able to receive over 5 million of PPEs in the DRC. And so far, we have reached over 17,000 community health workers receiving the PPEs, and mainly those are living in the rural areas. And for most of them, that was the very first time since the pandemic started to receive the PPEs. And if you hear their stories, how they were feeling exposed without having the PPEs before they received the concerned assignment that we had from ECAFA, it's amazing. Like, it's a life-changing for them, and mainly also their profession, they were feeling more comfortable, more confident, and to continue doing their work while they know they can protect themselves. But also, we were able to distribute over 7,000 face shields to support the polio campaign that was in October last year. And from the following slide, you're going to see the picture of community health workers during the polio campaign. And that was the only PPEs that was available for them to support the polio campaign. That's the picture on your left side. But also the particularity in DRC, we were able in some provinces, such as in Equateur province, where we are already using the drone to integrate the PPE in the distribution of other commodities where we use the drone. So we were able to use the drones to transport masks, medical gowns, face shield, to reach some of the hardest places to reach in Equateur province. So for DRC, it was a great collaboration between the Ministry and Village Reach, and we use what we are best to do in the country, the direct distribution, but also integrated distribution, meaning integrating the PPEs in the distribution of vaccines, in the distribution of other essential medicines. And we had a great success and great impact, great success stories coming from the community health workers who benefited from those PPEs. Maybe I can stop there. Thank you.
Yeah, thanks, Freddie, for sharing that. And just a very quick follow-up question. We know that it's very, very expensive to do air freight, especially for such bulky items. And you had mentioned that that was a constraint. How did the DRC go about addressing the constraint of the costs of air freight, and what got mobilized internally versus coming from outside the country?
Yeah, the biggest challenge in a country such as DRC, with the size of Western Europe, with very poor road infrastructures and a lot of geographical challenges, it is not easy to move products from the central warehouse in Kinshasa, which is the capital city of DRC, to the rest of the country. So that was the main challenge. And we have seen some provinces such as Haute-Uele province, where the governor of that province mobilized domestic resources over 50,000 US dollar to transport PPEs from the central warehouse in Kinshasa to that province, which is over 2,000 miles away from Kinshasa. And not only mobilizing the resources to transport the PPE to the province, but also ensuring the last mile distribution. It was a buy-in from the local authorities and from the onset.
Thank you so much, Freddie. So with that, we have reached the end of the first part of our webinar, in which we talked about the impact of both the pandemic as well as the impact of receiving PPE and allowing community health workers to resume what in some instances were severely disrupted activities, while these CHWs were actually expected to not only stream in to do more community-based care for COVID-19 with all the risks that that brings, but also to be continuing with their routine healthcare service provision. So you heard from James about how that was disrupted early in the pandemic, where CHWs could not accompany sick patients to facilities because they did not have sufficient PPE, and how that changed when they received PPE from Partners in Health as well as from CAF Africa. And then you heard from Dr. Maureen about sort of, both from a policy standpoint and the country leadership, the importance of having policies and SOPs and standard operating procedures in place, as well as, actually making sure that there is continuity. Several messages that we hear about fragmentation of funding, fragmentation of quantification, and the need to continue paying attention to that. And then last, we heard from Freddie, not just about how a massive country with many internal logistical challenges was able to uh, respond, but also about some of the innovative approaches that they used, including drones. So thank you again to James, to Freddie, and to Dr. Maureen.